Dr. Mark Trolice with Fertility CARE, the IVF Center. Nice to see you all again, actually be with you all again. And we're sorry we're just a little bit late over here. We had some patients come in. It was a pregnancy ultrasound, so it was a good thing. She had twins, but I didn't do the transfer. We were monitoring. We try not to have twins, of course, because it's a complicated pregnancy. But need I digress? We want to talk about today surrogacy, because I think there's a lot of misconceptions, if you pardon the pun, about surrogacy. I see a lot of patients, as you can imagine, and one question that they get from their friends and family and so on about when they're learning, when the friends and family learn that you're having trouble getting pregnant, they say, well, can I carry for you? And that's rarely needed. The indications for surrogacy are few, okay? The problem that most of the fertility patients have is conceiving, and then of course with recurrent miscarriage, that's a special category. But when would surrogacy be needed? Certain situations specifically, okay? One is obvious, with an absent uterus, either born with, called Mullerian agenesis, and there's also another situation that's called androgen insensitivity. Both of those conditions, you're born without a uterus. And the other, with being without a uterus, is surgical. Some patients have the uterus removed. So without a uterus, a woman can still donate her eggs to the surrogate. So she's still the biologic mother of baby, she just doesn't carry, okay? Another category of that is if the uterus is severely damaged, right? Now this can happen through a condition called Asherman syndrome. Asherman syndrome is where the inside of the uterus has lots and lots of scarring. It's a very unique situation, one that we see, of course, often because of our specialty, but Asherman syndrome can occur from excessive uterine manipulation, uterine surgery, like a lot of D&C procedures, particularly if about 2 to 4 weeks after delivery of baby, or even a miscarriage, if you develop an infection or something that requires a D&C a few weeks later, that is a high risk for scarring afterward. Uterine surgery from the outside, like a myomectomy, removing fibroids. If you make an incision in the uterus and then go through the muscle and enter the uterine cavity, unless that uterine cavity is reapproximated very carefully, it's not something that's going to, it will increase the risk of scarring inside the uterus, okay? So another category of that is medical complications. If a woman has a condition that that pregnancy increases her risk of harm, then we recommend surgery. Pulmonary hypertension comes to mind. Certainly if they are with a disease situation with obviously active cancer, of course, situations that heart disease, and any unstable medical condition where we feel the pregnancy itself is excessive risk to mom, or if she had a significantly difficult prior pregnancy for reasons that are unique, such as she develops antibodies to baby, and that can result in severe harm to baby. So another condition that is a contraindication to pregnancy, or at least a relative contraindication, is Turner syndrome. And we've seen 2 patients now these past 2 weeks. Turner syndrome is where you're lacking an X chromosome. So instead of being 46XX, you're 46X. And that causes a constellation of signs and symptoms that are classic appearing. Turner syndrome, they're usually short stature, they have a wide webbed neck, wide carrying angle, and no egg ovarian function. These women are often what we have called primary amenorrhea, no periods, and they actually don't go into puberty without hormones. There could be some variations called mosaic Turners, that some patients can actually have periods and even have pregnancy before their ovaries fail, but pure gonadal dysgenesis is Turner syndrome. The problem with Turner syndrome is that the risk of the aorta, which is the major vessels leaving the heart, of that causing a dissection or a rupture, is very high. Even if the MRI of the heart looks normal, we look at what's called the aortic size index, okay? Not to get too technical, but the risk of death of a mom in any pregnancy is about 1 in 10,000, okay? Really, really low. Turner syndrome is 2%, okay? So we've talked to our patients these last 2 weeks. They're going to be getting an MRI of their heart, seeing a cardiologist, seeing a high-risk obstetrician, and then thinking seriously about whether they're going to carry the pregnancy and take on that risk, unfortunately, of morbidity and mortality, or go on to surrogacy with a donation, okay? So those are significant issues with the reasons for surrogacy. There's many surrogacy agencies that we can connect you, and we're looking forward to working with you all. Have a wonderful week. Hope that was helpful, and we will see you in a week.